Okay, let's discuss about dizziness today. Okay, first of all, what is dizziness? Okay, dizziness is in fact umbrella term. Okay, umbrella term for vertigo, pre-syncope, disequilibrium, and non-specific lightheadedness. Okay, patient may tell dizziness to all of these things. Vertigo, also known as spinning sensation. Okay, subjective or objective spinning sensation is also known as vertigo. Pre-syncope means like near fainting. Okay, near fainting. Disequilibrium means imbalance. If a patient feels imbalanced, they can tell us we feel dizzy, okay? And there's something like lightheadedness, okay? You have to find out which of these four things our patient means by telling dizziness, okay? After that, we have to take a short history. When did the symptoms start? Okay, how long is it? How long they're lasting? And what is the trigger for that? Whether that is spontaneous or not. After this, we'll evaluate the patient. I'll try to give a flowchart which will help you evaluate the patient of dizziness. Okay. If a patient comes to us with dizziness, we have to know if that's episodic or continuous. Okay, and if that is episodic, if the dizziness is episodic, then we have to find it's triggered or not. Okay, triggered or spontaneous. So that if it is episodic and triggered, then we have to find out what is the result of Dix-Sulpide test. We have to do Dix-Sulpide test. You can find numerous videos in YouTube how to do Dix-Sulpide maneuver. Okay, Dix-Sulpide maneuver, and if Dix-Sulpide test is positive, that means the patient is having BPPV. Okay, benign paroxysmal positional vertigo. And if Dix-Sulpide test is negative, that can be orthostatic hypotension. Okay, orthostatic hypotension is also episodic and triggered by our standing from sitting or supine position. So that can be orthostatic hypotension. We have to assess orthostatic hypotension by measuring BP in supine position and after standing for about 3 minutes. If there is fall in systolic BP of more than 20 mmHg or diastolic blood pressure less than or more than 10 mmHg, then we label it as orthostatic hypertension. Okay. After that, if the episodic and spontaneous, okay, spontaneous without any trigger, then we have to find out if the patient is having hearing loss or not. If the patient is having hearing loss, that can be Meniere's disease. Okay, if the patient also has migraine headache, then that can be vestibular migraine. Vestibular migraine. During associated psychiatric symptom, then that is panic attack or any other psychiatric condition. Okay, this is all about episodic dizziness. Okay, after that we'll deal about this all about episodic dizziness. can take a screenshot of it to review later, okay? And after that, if this patient or patient is having continuous dizziness, continuous dizziness, then we have to find out if it is associated with trauma or toxin or is spontaneous, okay? Spontaneous. If it's associated with trauma or toxin, then that can be due to viral trauma or due to medications. Sometimes benzodiazepines and all that medication can cause dizziness, which is continuous, okay? We have to find out that. But if that is spontaneous, then you have to do Hinge examination. If in Hinge examination means head impulse, nystagmus and test of skew. Okay, and in Hinge examination, if there is saccades present, or there is nystagmus which is unidirectional or horizontal, or there is normal test of skew, then that is peripheral etiology of vertigo, and we have to rule out vestibular neuritis, okay? But if there is no saccade, if the nystagmus is dominantly vertical, okay, dominantly vertical, torsional or quasi-port, bidirectional, and if there is abnormal test of skew, then there is mostly central etiology of vertigo, and we have to rule out stroke or TIA or any other central cause which can cause vertigo, okay? So these are the things we have to do. We have to look out, okay? If there is episodic vertigo, we have to know it's triggered or spontaneous. If triggered, we have to do the sulfide test. If positive, BP. If negative, we have to do BP in supine and standing position. If there is drop in BP of 20 mm as in systolic and 10 mm as in diastolic, then it can be orthostatic hypertension. If the patient is having episodic vertigo which is spontaneous, we have to rule out Meniere's disease, vestibular migraine, and panic attack or psychiatric symptoms. While if the dizziness is continuous, then we have to look if that's associated with trauma, toxin, or spontaneous. If that's due to trauma, can be due to like a viral trauma or a toxin like medication like benzodiazepine, or if that dizziness is spontaneous, then we have to do Hinge test to rule out peripheral etiology or central etiology of dizziness. After knowing the etiology of certain type of dizziness or vertigo, we'll give the treatment accordingly. Thank you. This much for today.